back. Hip pain is a common issue that is caused by a number of factors, so it's important to visit a doctor and get the proper diagnosis and treatment. And please welcome to the show Dr. Michael Adams. He is with Jacksonville Orthopedic Institute. Thank you so much for being here. You joined the JOI team back in March, but first I have to say thank you so much for your service as a Marine who deployed twice to Iraq. Thank you.
Yes, ma'am.
Let's talk a little bit about your service first, and then we'll get into the hip pain and JOI and what brought you to Jacksonville. But talk about your service. Where were you stationed?
I was stationed up in South Carolina in Beaufort at Naval Hospital, Beaufort. So we take care of the Marines up there at the air station at Parris Island.
Okay, and then what made you want to come to Jacksonville?
We like the coast. We like the Southeast. Trained in New Orleans, so the Southeast is very near and dear to my heart. And we first moved to Panama City before coming to Jacksonville, and so we wanted to trade one coast for the other. And with Jacksonville Orthopedic, since we have the Jaguars and we have the Sharks and the Armada and other sports teams, it was a nice way to advance professionally into what I do, which is sports medicine. It's
a great city that you've chosen to come and live. I'm sure since March you've had a good time so far, and I'm sure you've been very busy, obviously, with the start of all the sports seasons.
Yeah, we have a great time, but we've been very busy as well. Work takes up a lot of time, but there's a lot of stuff to do around Jacksonville. We love the beach. We love all the areas that has to offer.
Well, let's talk a little bit about hip pain, because this affects athletes, sure, but it also affects non-athletes as well. So at what point in time should we come and see someone such as yourself at JOI?
Sure, that's a great point. Hip pain affects everybody, athletes or not. And many times it's pain that just starts without any athletic injury whatsoever. So I always encourage people that if they have pain that lingers for more than a day or so and they try their standard treatments, taking some Advil, taking some time off, and it's just not getting any better, that's when they need to seek the care of somebody that specializes in hip pain. And orthopedic surgeons, especially over at JOI, we have many people that fit that bill.
Yeah, and let's talk about why it's so important to then find somebody, a group such as JOI, who can then go in and create the specialized treatment for hip pain. Why is it so important that you find a specialist for this?
Well, it's pretty critical that you find somebody that's able to take care of and diagnose that pain for you. Many times it doesn't require surgery, but there are often times that actually surgery is a necessity, and you want somebody who is well versed in doing those kind of surgeries. We specialize in doing minimally invasive surgeries using the arthroscope or the high definition video camera, where we can get people back to their daily lives, back to their athletic activity sooner than if they had to have more traditional open type surgeries done.
Yeah, talk about this minimally invasive procedure and how that works. How do you go in one day, you're leaving the next, or you're leaving the same day? What's the process? What can people expect?
It's outpatient surgery. So you come in, you go home that same very day. We do it through small little incisions instead of large incisions, so it spares muscles, it spares tissue, it's more cosmetic. We use a high definition video camera, just like the video cameras that we're on right now.
Which is unfortunate for us. We always want to get a filter on there.
We have 4K technology nowadays that allows us to actually repair torn tissues. It allows us to go in and remove problems and get people home and back to their regular activities.
Is this just another example of how technology is creating new options for people? Because I think some people might think that, well, my hip is hurting, I don't want to go, it's surgery or nothing. I know I'm going to have to get surgery when we go in, but that's not necessarily true nowadays.
You're right. Surgery is very rarely the answer. All right, surgery is really the answer in maybe 10% of people that actually have problems with their hip, or any other joints for that matter. So, but just like in other areas, if surgery is an option, there are very good things that we can do that don't require long recovery time frames like they used to.
What are some of the symptoms that somebody might be experiencing right now watching this segment that would clue them in on, I need to come and see you?
There's a lot of different areas around the hip that people experience pain. Sometimes it's in the outer aspect of the hip, sometimes it's in the front area in the groin, sometimes it's in their buttocks, sometimes it's in their back and they think it's their back. Very rarely it can also be in their knee. So any of those areas are definitely places that are the hallmarks of having hip problems, and those are what people need to look out for. If those are lingering problems that they have, those are lingering areas, that's when they want to call somebody.
And if someone walks in the front door, what can they expect as far as seeing you, seeing the other physicians there at JOI? Walk me through a typical diagnosis.
Sure. The first thing they're going to do is they're going to be met by a friendly face and a smile at the front desk. We're very patient-oriented. We're very family-oriented. We like to treat our patients like they are a family, or like we'd like to be treated ourselves. So we want to make sure they're at comfort. We want to make sure they're at ease. After the check-in process, then they're going to see the doctor. They may have some x-rays taken. That's very common for us to do because that will allow us to identify any simple problems or even more complicated problems.
Yeah. Well, thank you so much for being here. And sir, thank you so much for your service to our
Thank you
country.
for having
We are
me. I
very
appreciate it.
appreciative
Thank
of
you.
that. And we'd like to thank Jacksonville Orthopedic Institute, of course, for coming on and sponsoring this segment. For more information, you can find an office near you by going to joi.net. The number is also on your screen, 904-JOI-2000. You can get more information there.